volgende insetsel het volwasse inhoud. So, dis miskien nou 'n goeie tyd vir die kinders om te gaan koffie maak. Dr. Kathy, hoekom sal iemand so 'n prosedure doen?
Well, vaginal rejuvenation has actually become a very commonly requested procedure, especially due to childbirth and also pregnancy, menopause, and some ladies are just born with laxity or abnormality in that area. So I always like to describe it as an aeroplane that's coming into land. When the landing gear drops and those flaps come out, they're supposed to come back in. But on some ladies, those flaps stay out, and those are known as your labia minora, and that's the area that we're actually working on to try tighten and just get everything back to where it originally was.
So hoe werk hierdie prosedure?
So today I'm going to be using a radio frequency machine that works on the patient's water in the cells and creates a current which eventually leads to the tightening. And it can actually be used on any skin color. It's not like your other lasers that work on the chromophores or the color pigment in skin. And it's a heat-based treatment. I've put a protective cover over the machine, and Lynn has a grounding pad on her and some gel at the tip. And then it's going to slightly warm up, but nothing too uncomfortable. She should not feel any pain, just a slight amount of heat, and she just lets me know if it's getting a little bit too hot, then we move to a different area. So on a scale of 1 to 10, the heat should never go above an 8. So if you're feeling any heat, just tell me immediately and I'll move or else I'll stop. It's very important that you let me know. It shouldn't be uncomfortable at all. Okay.
Is daar 'n spesifieke rigting waarin u moet beweeg?
Yes, so we first do the labia minora, then 4 minutes on the labia majora, and then we tighten up the periurethral area, which helps a little bit with your incontinence.
Nou, u werk aan die buitegedeelte. Wat van die binnegedeelte?
So it's a very good question because internally, especially after your pregnancy and natural childbirth, it's very important to still do your Kegel exercises. And you can actually get Kegel balls and physio equipment to help with that area. And what you're going to find is that's also going to help with urinary continence. Like sometimes when ladies jump and they feel like they need to wee a bit, that's all going to be helped by tightening that whole area and this whole area. And another positive change we also see with this is actually a color change. So we see the pinkness coming back, whereas sometimes, especially after pregnancy or hormonal changes, the skin darkens and that can really bother some ladies.
So wie kan almal dit doen?
Actually, any lady of any skin color can do it, and it's usually your middle-aged ladies or after pregnancy, that age group. But we do have younger women who are sometimes born with a large labia that's irritating them that also come.
En watse resultate sal hulle kan verwag?
Aesthetically, it obviously looks a lot better, which gives the ladies a lot more confidence, which is really nice. But also it helps with your sexual satisfaction, mainly due to lubrication and blood flow. But we've had some really, really nice and amazing feedback.
Kan mans dit doen?
We have had requests for this around the anal area, and we are trying it on hemorrhoids. And because the tissue is so responsive, we are expecting it to work, but it's all quite experimental.
Ons gesels 'n bietjie met Elbie wat die behandeling 'n ruk terug gedoen het. Elbie, jy het al reeds die prosedure gehad. Wat het jou laat besluit om dit te doen?
Ag, weet jy wat, ek het al 'n kind gehad en ek het net daarvan gehoor en gedink dat ek dit gaan probeer en sien of dit werk.
Hoe het jy dit ondervind?
Weet jy wat, my verwagtinge wat ek gehad het was, dit gaan warm wees, dit gaan ongemaklik wees, maar die prosedure self was 35 minute en dit glad nie warm nie. Dit was eintlik 'n so warm hitte wat jy gevoel het, maar nooit 'n brandgevoel nie. Want hulle gebruik 'n dik sonar gel wat hulle opsit, so die hitte is nie heeltyd op jouself nie.
En watse resultate het jy gekry?
Och, uitstekend. Wat basies gebeur het is die hele innerlabia en binnelabia en uiterlabia het saamgetrek en gerejuvenate. Selfs die kleur het verander, waar dit donkerder soos wat ons ouer word, het dit verminder.
Het jy enigstens 'n verbetering in jou sekslewe gevind?
Weet jy, ja, nie na die eerste 2 sessies nie, maar so by die 3de sessie het ek gevoel dis bietjie stywer.
Nou, hoeveel sessies het jy al 'n verbetering gesien?
So vir die 3de een af het ek 'n drastiese verbetering gesien.
En hoeveel sessies het jy al reeds gehad?
4.
En sal jy dit vir die dames daar buite voorstel?
Beslis, daar's soveel mense wat weet soveel insecurities het daaroor, wat dit graag wil laat doen, maar hulle weet nie weet waar om te gaan, met wie om te praat nie.
En hulle skaam.
Dit is ja, dis is ding wat mense nie maklik oor praat nie.
Wat se voorsorg en nasorg moet die kliënte doen?
So we need the patient to be very well hydrated because radio frequency works on the water in the cells. And also, because the process works on inflammation, we actually want inflammation. So no aspirin, dispirin, anti-inflammatories before the procedure and for 4 to 7 days after the procedure.
En hoe lank hou die prosedure?
So it takes on average about 16 minutes. It's very comfortable. I'm sure you can see our patient isn't feeling much. And it should be repeated weekly 4 times.
Help dit enigstens met 'n pasiënt se emosionele welstand?
Oh yes, absolutely. I find when the patients first come in, they're very shy, even in front of the doctor. And by their 4th treatment, they're completely confident and sexually confident and have improvements. And that's really the best part of it, just to see that transformation in the woman's confidence.